14 minutes gone past the hour of 11, and this is IKD 106.1 FM. You know, every Thursdays we have healthy conversation on the issues, and this is in partnership with General Hospital Ikorodu. Our health is very important to us, and that is why we have decided that every Thursdays, such as this one, we will talk about health matters to help every one of us out there stay on a know and how to stay safe as regards our health. Like I said earlier, we apologize for starting up a little bit late. This is due to some unforeseen circumstances. However, today, this conversation belongs more to every woman out there, a mother or an intended mother, as well as fathers or intending fathers out there. Because you would agree with me that a stage of pregnancy in the life of a woman is a very important stage that you cannot take for granted. This is a stage where a woman has almost zero control over her own self, and it will be even more tough or more serious when other things get involved in this kind of a situation called pregnancy. This would bring us to the conversation today talking about anemia in pregnancy. This is something that has been from a very, very long time. It is not new, even though it is not right, depending on how the situation may be. So today on the issues, we will talk about anemia in pregnancy. What are the causes of anemia, the symptoms, prevention, and how best these can be treated. That is why I said it is important for every mother or intending mother, every father or intending fathers out there to be a part of this conversation today on IKD 106.1 FM. And you know how we do it, where your calls, contributions, or questions will be accommodated on our studio lines 0904 1061 or 0904 1061. I am Opeyemi Adebambo. I'll be your anchor for today on the issues alongside our medical practitioner, a doctor who sure knows her onion well within the medical space. Talk about Dr. Ilori Adesanya. She will be our guest for today. Dr. Ololade will be talking to us on anemia in pregnancy. But we'll go on this very, very short break. When we return, we get talking on anemia in pregnancy. Good morning, Lagos. Good morning, Nigeria. You're very much welcome back to the issues on IKD 106.1 FM. Do not, of course, forget that you can join this broadcast via our website www.ikd1061fm.ng. Now, talking about our focus for today, anemia in pregnancy. First off, it will be nice for me to welcome my guest in person of Dr. Ilori Adesanya or Lolade. Good morning and thank you for joining us.
Good morning. Thank you for having me.
Thank you very much. Today we talk about anemia in pregnancy. This is a situation that is not new. It is not something that has not been heard before. But however, it is something that is still not pleasant in a way. So to start off this conversation, everybody and anybody can easily relate when we say pregnancy and who a pregnant woman is. But not everybody will be able to relate with the word anemia. So let's begin from there. Help us understand in a layman's language when we talk about anemia. How best can you put this to our understanding?
Okay. Simply put, anemia is when there's a low level of blood, which can either be the quantity of the blood or the quantity of the red blood cells, which are the things that carry oxygen actually around the blood. So if there's a low level of blood, simply put, we say that the patient or the person is anemic. Now, it's not limited to only pregnant people. Even men and women can be anemic. But we're focusing on, focusing on pregnant people today.
Okay, thank you for that one. So, in clear terms, that is when there is low blood in the body system of a pregnant woman.
Yes.
All right, thank you for that clarification. Like I told us, you will be able to ask questions today on this conversation. And now, let's start with the myths first. We've been able to gather before now some of the myths that are associated with anemia in pregnancy. Some of them might be true, some might not be true. And that is the reason why you're here to help us shed light on understanding this. Some are of the opinion or assumption that when anemia in pregnancy occurs in a woman, then that means she's maybe underaged or she's a teenage who actually got pregnant. Please help us clear that first before we go ahead.
Okay, it's not limited to teenagers or young mothers. Even some people that are the extreme of the reproductive age can also have anemia in pregnancy because the cause is not limited to. There are different causes which we'll talk about as the program goes on. Yes. So we'll see that it's not just about the age group. They may be at a higher risk
Mm.
of coming down with anemia because of at that age group there's probably nobody responsible for provision,
Mm.
and it might be difficult for them to get access to healthcare. It might be difficult for them to have a balanced and nutritious diet,
Mm.
because at sometimes they might be involved in one or two things. Might be still be Some of them might even not have a home
Mm-hmm.
at that age, because maybe from a rape, it might be from some illegal or even non-consented intercourse, and so
Mm.
there's nobody responsible at that age group. Sometimes we even tend to push them out of the house for
Mm.
some families that have these strict rules. And
Mm.
so at that age, they are predisposed to malnutrition,
Mm.
which may be the leading cause in that age group, but it's
Okay,
not
so
restricted.
talking about malnutrition now,
Okay.
that will take me to my second myth or assumptions of
Okay.
people when they say that, some will say it is about the age, maybe
Mm.
the woman or the lady or the girl is on that age, but you've cleared the air on that, that it is not necessarily about age. Now, some would also talk about nutrition. Some will say because this woman, lady, or girl is not eating the proper food, the proper meal, balanced diet, and all that. So help us understand that part too as well. How true is that your balanced diet also has a role to play in anemia in pregnancy?
Okay, so what you eat is the raw material that your body needs to
Mm.
process the things it will work with. If your body cannot get what it needs from the food you eat, then there will be a reduction in the quality and even quantity of what you need.
Mm.
So a woman not getting a balanced diet means that the body doesn't have enough raw materials to produce what it needs.
Mm-hmm.
And everything in the human body has a lifespan.
Mm.
So for the red blood cells, for example, they have an average lifespan of 120 days, which is about 3 months. So if within the next by the time it's time for production of another set, there's nothing, we'll notice that there will be a decline. So
Mm.
what you eat is as important, is very, very important, because it is what your body needs to make what it needs.
Mm. Okay, thank you very much for helping us clear that. So, at this point, I would like for us to break the back of the camel by
Okay.
getting straight into the conversation, talking about anemia in pregnancy. First, it is very important and paramount for us to know what exactly are the causes of anemia. What causes anemia? How come?
Okay, so in our environment, there
Mm.
are some common causes. Taking a global view, there are, depending on the region, there are
Mm-hmm.
different views. Okay, so in our environment, number one cause malnutrition, which we've already
Malnutrition.
mentioned.
Yes.
So a lot of mothers early in pregnancy, a lot of them have vomiting, a lot of them are not able to put food down,
Mm.
and that can predispose them to having low blood.
Mm-hmm.
Also, for some of them, they have an underlying illness. They have an underlying illness. So, a mother that has probably a blood hemoglobinopathy, for example, a mother that is a sickle cell
Mm.
patient would most likely have blood level. Also, in our environment, commonly we see that infections,
Mm.
parasitic infections such as malaria or hookworm, schistosomiasis, people that have these infections also tend to have low blood volume, because they the parasites would get what they need to feed, and then the body is compensating for two human beings in
Mm.
addition to the parasites, making it more demand on the body, less production. So on the average, everything comes down.
Down.
Yes. Then for some mothers that the spacing between their pregnancies is so short,
Mm.
so you see that a woman, her baby is not yet a year and she's already pregnant for another baby. The body has expended so much in the last 9 months trying to cater for both mother and the new fetus, and then it has not yet boosted up its reserve,
Mm.
and you are already pregnant again. So what we advocate is that for mothers, wait for at least 2 years, one to
Mm.
2 years, let your body regain what it has lost
Mm.
before you start planning to get pregnant again. Because we've noticed that in mothers that tend to have these back to back deliveries, their blood levels are usually shorter
Mm.
than, yes. So then for some mothers also that have chronic diseases, maybe someone that has maybe chronic kidney disease or has a maybe cancer or for whatever other form of disease, they are also predisposed to having low levels. But in our environment, the commonest causes, infections, we've mentioned malaria,
Illnesses,
yes,
yes, and
illnesses,
malnutrition too as well.
yes.
Looking at these three major causes within our own axis here, like
Okay.
you rightly said, it differs if I'm not mistaken, what happens here or how it occurs here might be different from another region. Malnutrition, infections, and then illnesses are the key. When you talk about illnesses, you know, in terms of malaria, for instance, now
Okay.
that is a very common one. Is that another major thing to worry about when a woman always break down with malaria most times, especially when she's pregnant? Could this be a major cause to anemia in pregnancy?
Yes, and because what happens is that the malaria parasite feeds on the red blood cells.
Mm,
They live in the red blood cells, and then by the time they've occupied it so much, we call it hemolysis. The
okay.
red blood cell bursts.
Mm,
So that is what malaria parasites do to the body.
mm,
And like I said earlier, while I was trying to define what anemia is, I said it can either be a low level in the blood or low level in the number of red blood cells available in the body. So malaria technically reduces the number of red blood cells in the body. So that is why for a woman that is registered in a proper healthcare center, part of the things we do during their antenatal care
mm.
is to give them preventive medications for malaria. So we try for them not to even get hit by it. We don't even want you to have it
Mm.
because you know that it is quite popular in our environment to come down with malaria.
Mm. Thank you very much for that clarification. If you're listening to us today on the issues and you're out there, please do well to call. If at all there are questions as regards anemia in pregnancy, and do not also forget that our guest today, Dr. Ololade, has made it very clear, most especially to women who, there are some families, Dr. Ololade, who will tell you that we just want to get done with childbearing, and then you just see back to back child delivery. So you heard it from the doctor. Please, at least 2 years is what you said. Give a space of 2 years before you start considering having another child, so as to help your system build up again. I would like to ask if anemia in pregnancy could be hereditary. You talked about illnesses, and you said that maybe for a family that the mother has this and all that. So help us understand, for a lady or a woman whose mother suffered anemia during her own time, are there tendencies that the daughter who is also pregnant might also go through that route of anemia in pregnancy? Is it hereditary?
Okay, anemia in itself
Mm.
is not hereditary.
Okay.
Some of the causes may be, for example, a mother who is HBSS, who is a sickle cell patient, who is
Ah.
a sickler,
Mm.
who ends up, maybe she is not aware of her genotype as at the time she got married, and then the child also makes the same mistake,
Mm.
may have some continuity in their line.
Mm.
But aside from that, or any other hemoglobinopathy, other causes are not necessarily hereditary.
Mm.
So if you eat well, if you protect yourself from infections, prevent parasitic infections as much as you can, you are not likely to come down with anemia in pregnancy. Let me also mention at this point that there are some women who usually have heavy menstrual flow,
Mm.
and they are losing blood every month back to back, and by the time they are conceiving, their blood level is already low. For
Mm.
such women, yes, and for such women it will be, it's always important for them to make sure that their pregnancy is planned, the blood heavy flow is controlled,
Mm.
and then they can now proceed to get pregnant.
Mm. We appreciate the fact that you're helping us have a proper, clear understanding on this. But one very major germane part that you help us deal with, and the reason why you're here, is how best we can prevent, how best mothers out there listening to you can prevent anemia in pregnancy. But before we get to that stage, let us talk about premature babies now. Some also believe that anemia in pregnancy is what brings about premature baby. Is there any relationship? Is there any a relationship between premature babies and anemia?
Okay, so a woman whose blood level is low is
Mm.
at risk of having a preterm delivery.
Okay.
A preterm delivery because one, something is precipitating that low blood volume.
Okay.
Something is making you have a low blood volume.
Mm.
Number two, the body might not be able to cope with maintaining both mother and baby, and then the body might signal for the body to actually bring an end to the pregnancy,
Mm.
which can make the woman fall into preterm labor. That's why most times when we see a woman with low blood volume, we want to, as much as possible and as quickly as possible, correct.
Mm.
Because the long-term things that low blood volume can cause. It's not just danger to the mother, it's danger. There can also be very high danger to the baby.
Mm.
Delivering a baby before 34 and 37 weeks, that is term,
Mm.
comes with its own risks.
Mm.
Baby is at risk of a lot of things, at risk of infections, at risk of having some form of neurological damages, a lot of things.
Mm.
So having a preterm baby, preterm labor, is one of the things we also want to avoid.
Mm.
So for a woman who is having low blood volume, as much and as fast as we can, is something you don't play with. Once you just see that this blood level is declining,
Mm.
you immediately intervene.
Thank you very much, Dr. Ilori Adesanya. But you would agree with me that there are people out there who has this, I don't want to say hardened heart, or this mentality of what will be, will be. It is not me that it will happen to for the first time. It has happened before. I'll be fine. Can you help us understand how dangerous anemia in pregnancy could be? Because some will just tell you that what is there? What is Sheyamiri? It has happened before. How dangerous is anemia in pregnancy?
Anemia in pregnancy is very, very dangerous because it affects the outcomes, like I said, both for the mother and
Mm.
for the baby. Okay, so for the mother, short term outcomes, that one, the mother can lose consciousness. So it usually starts with fatigue. You get tired easily, and then you begin to feel dizzy. And if it's not corrected, the body tries to compensate. Sometimes they might have headache. Sometimes they might be having palpitations. Your heart just beats fast. You just walk a short distance and your heart is beating fast. You can't compensate. You are breathing fast. It shows those are signs that your heart is overworking
Mm.
and trying to compensate.
Mm.
Now, if this continues for a long time, it can lead to what we call anemic heart failure.
Mm.
And if the heart failure continues, the heart continues to enlarge, it leads to cardiomyopathy, and then the cycle continues, and then eventually the heart muscles give up, and
Mm.
which will now eventually lead to the death of the woman.
So anemia could actually take lives.
Yes, it can actually take
Wow,
lives.
that's serious. When you talk about headache, you talk about dizziness. That wants me to ask you, when you say symptoms, what are
Mm.
some of the commonest symptoms that are there any physical symptoms? Because pregnant women will just feel, oh, some will even tell you the symptoms of my pregnancy is I get dizzy, I have headache. They might
Mm.
not even know it is anemia. So tell us, what are some of the symptoms to look out for as a pregnant woman if it is anemia? When you see this, just know that this is anemia knocking at the door.
Okay, for a pregnant woman, first thing is that they might begin to feel weak,
Mm.
dizzy. Some might say it comes with the pregnancy. But
Mm.
by the time you know that you are eating well, what usually comes is that the body is asking for more
Mm.
in the early stages of pregnancy, trying to make up raw materials to build up. And if the body is asking for more, I'm eating enough, but I'm still feeling dizzy, I'm still feeling weak. Some of them even just suddenly lose consciousness.
Mm.
That gives us a high index of suspicion that yes, this patient's blood level is actually low.
Mm.
Some just come in and say, oh, my heart is just beating. Once I just walk from this place to that place, my heart starts to beat fast.
Mm.
I can't do things without resting or leaning on some things. That shows us that your blood level may also be low.
Mm.
For some of them, they may begin to notice that their hands, their palms are white, their eyes are also very white.
Mm.
For some of them, they may notice that if it has been something that has been going on for a long time, there may be some changes in the shape of their nails.
Mm.
That is for someone that's had it for a pretty long time. So those are the signs, symptoms that the patient will see and then come to us that will necessitate us to have a proper investigation.
Mm.
And then if we now pick anything from these investigations, we proceed to treat. If there's nothing, we replace the losses and continue searching for, because there's always a cause.
Mm.
So you continue investigating till you find one.
Our doctor guest today has helped us understand that anemia is not just a woman thing for pregnancy alone. It occurs in also the male gender. But today we are majorly focusing on anemia in pregnancy, and it's important that we know all of these things. We will talk about how best we can prevent this. I also want to believe it's curable. If we get to that bridge, we would cross it. And you can be a part of this conversation, like I said earlier, by putting a call through to us. Let us talk about the preventive measures now of anemia in pregnancy. How can anemia be prevented in pregnancy?
Okay, so for a pregnant woman, the first step is to ensure that your food is rich in the classes of food.
Hmm.
So you must have a diet that is rich enough to give you this. Now, the common sources of the raw materials for producing the red blood cells and the blood components, the common raw materials that the body needs are common in green vegetables,
Hmm.
fruits, vitamin C rich fruits. Vitamin C rich fruits also help the body to absorb the iron content in the sources of food that you have eaten. So we also encourage our pregnant women to have diets rich in protein, high protein diets, egg, milk, fish. They also help. So if you are a pregnant woman that is just feeding on junks,
Hmm.
just okay, eat Indomie today, just eat bread. You understand what I'm
Hmm.
trying to say?
Hmm.
Then you are likely to be having a diet that is deficient in the raw materials.
Hmm.
Some of our mothers also think, oh, I don't need to eat healthy. I just need to take my supplements.
Hmm.
Yes, there are recommended supplements that you should take in pregnancy, but that doesn't take away the fact that you should eat healthy.
How about those kind of women that will just tell you that I don't actually even feel like eating anything? I think that is some symptoms for some pregnant women. They'll just tell you, I don't want to eat this, I don't want to eat that. Don't you think that can also bring about anemia to such a person?
Yes, so some pregnant women have some selective components to their early symptoms in
Exactly,
pregnancy.
exactly.
But as the pregnancy advances, we see that some of these things begin to reduce. They are
Mm,
able to tolerate almost anything. For some of those people that we see that they are not tolerating much,
mm,
sometimes we have to keep them in the hospital for a little while, try to supplement some of the things that we think they need at that time, and then probably double the dose of their supplements that they are on.
mm,
But that is not something we will do throughout the pregnancy except it is indicated.
mm,
You understand me?
mm,
The most important thing is that we're trying to reduce you, we're trying to prevent you from even getting sick. So we
mhm,
want you to do the right thing ahead. So eat well. Very, very important. If you can't tolerate maybe the smell of some things, there's no way you are allergic to everything or you can't tolerate the smell of everything that is nutritious.
mm.
At some point, there's rarely anybody that can't take vegetables when they're pregnant. They may
Okay.
be allergic to maybe the oily content. So what we usually tell them is reduce the quantity of oil that you are cooking with. You don't
Mm,
even have to make your vegetables with oil. You can just parboil,
mm,
steam it, and then eat it with your rice, eat it with your yam, and you're getting as much as you will even get from. So that's what then we advise them, fortify your foods as well. Add crayfish to some of the things you are eating. Add milk, add egg, and we advise just like that. So we start for those that are having maybe early pregnancy symptoms that are throwing up almost anything. Reduce the oil content in your food, and most of them do very well with
mm.
just that simple
You know,
interventions.
anemia, like you said, does not just affect the mother alone, but as well affects the unborn baby, the child in
Yes.
the belly. But then, could anemia occur more than one time? You know, maybe for some people who will tell you that, oh, I had anemia during my first child, I'm done with. There are some illnesses that it occurs once in the human system, and that's it. But could anemia occur more than one time to a particular woman?
Yes, it can happen more than once to a particular woman.
Mm,
Okay, like we always say, every pregnancy is different. But if the woman's lifestyle, from the things I've mentioned, remains the same throughout this pregnancy, she's likely to have that problem.
mm,
Also, for those of them that we have identified to have these hemoglobinopathies, the sickle cell people and all that, they are also likely to come down with low blood volume or low blood levels because pregnancy is a stressor for them. Already they can't accommodate too much stress. So pregnancy is a stressor for them. So for some women, yes, with certain peculiarities and probably the same lifestyle, they can have anemia in each pregnancy if the same thing is being repeated in those
so it could be
pregnancies.
more than one time.
Yes.
I was even going to ask you who are the group of women who has the more tendency of suffering from anemia, but you've made that clear already with what you said, most especially the sickle cell women. This will bring me to my next question before I would open the phone lines on 0904 081 1061 or 0904 082 1061. Talking about anemia now, and talking about the mothers and the unborn baby too as well. How best can one, diagnose? We're talking about diagnosis now.
Okay.
Are there processes of diagnosing anemia and oh, you already have it? Is there any process like that, or is just something that you just need to look and say, oh, that woman coming has anemia? Is there any process of diagnosing anemia?
Okay, yeah, so there's a process in diagnosing anemia. So first of all, um the diagnosis starts with being able to even classify.
Okay,
For a patient that is severely anemic, even by seeing the patient, you can tell that this person is very anemic.
that is when it has gone bad.
Yes, that is when the blood level is, the hemoglobin is as low as lesser than 7.
Mm.
So the WHO standard is about 32%. So your blood level should be at least 32%. For the hemoglobin level should be about 11. That's the WHO standard. So they went further to classify it to mild, moderate, and then severe. So for a patient that is very bad, the hemoglobin level is less than 7, you can see it that yes, this patient is. But for those that have mild anemia or moderate anemia where they just feel breathless, they are upon taking some steps where they just know that doctor, sometimes when I stand up I feel dizzy, I'm not able to do as much as I can do before. So we request for basic investigation. So what do we want to do? We want to do what we call a full blood count. A full blood count tells us about some important parameters in the patient's blood. But for this purpose, what we are concerned about is the PCV, or the hemoglobin level. So when the results are out, we check, okay, does it fit the criteria? If it does, then we move on. Sometimes some of them will come in with some symptoms that may be pointing to, oh, this is the underlying cause. So the woman comes in and she tells me, oh, I've been having this headache. I feel feverish in the night. I've been vomiting. I can't take anything down. I'm having general body aches. Most likely that is malaria. We'll still do a blood film to confirm that that is malaria. Then for some of them, it might just be a parasitic infection, like I mentioned earlier. And the way we can see this is if maybe the eggs of those parasites are passed. So sometimes we may request for a stool culture, or what we call stool microscopy. Some patients may say, oh, it's just my blood level that is low. Why are you asking for my stool? Some of the causes, I'm just trying to elaborate that
Yes,
some
please.
of the
Yes,
things
please.
that can cause it are actually passed in the stool. If we take a look at your stool sample and we find a particular parasite or the egg, then we know that, oh, this is most likely what is causing this low blood level. For some of them, it might just be a urinary tract infection. So you may also still ask for your urine sample. We want to test the urine, see if there's any form of infection in the urine. For some people, they can give you a history of maybe they've had a long cough for more than 2 weeks. That might point to tuberculosis. And tuberculosis can also lead to low blood level. So our investigation is not just streamlined. We add it to whatever history you give us to know what and what to ask for. So, but the basic thing you do when you come is you must do a blood test. You want to do your full blood count. You must do a stool microscopy. We want to see if there's anything in your gut that is causing, predisposing you to having low levels. We also want to do a urinalysis for you to see, oh, if there's any infection in your urine that could be predisposing you to that. Based on whatever we get from those, then we advance and go to the next stage.
While you were talking, you talked about the mild, the moderate, and then the severe. I am aware that there are types of anemia. Could this be the types of anemia, or there's something else that we call the types of anemia?
Okay, so what I mentioned earlier was just a grading system.
Oh, okay.
There
Oh,
are
okay.
types of anemia based on some of the common causes. We have the folate deficiency anemia. We have the vitamin B12 deficiency. There are a lot of them. There's
So anemia is
iron.
not just one
Yes,
anemia.
there's
Anemia.
iron deficiency anemia. There are some that are caused. There's a subgroup nutritional anemias. There's some that is because of the blood type, the hemoglobin. So those are called hemoglobinopathies. So
Oh,
there
okay.
are different things that can cause different anemias. So those are the types. But what I mentioned earlier was the
But when
classification.
it gets to the severe, that is the time when it gets worse and bad.
Yes.
All right, now let's talk about how it can be treated. We've talked about the symptoms, we've talked about the risk factor where you said it's as dangerous as death. It could take lives. And we've talked about the preventive measures. Maybe we should hammer a little bit more on how we can prevent this anemia? That will help our listeners know better about anemia. Let's talk about the preventive measures.
Number one, eat well, eat healthy. Number two, make sure your environment is free from the major risk factors for breeding mosquitoes.
Mm.
So make sure that you don't have stagnant water around your house.
Mm-hmm.
Make sure that you're sleeping under insecticide protected nets.
Mm.
Make sure that you're doing everything to reduce the mosquitoes in your area. Then for before pregnancy, try to do regular deworming so that you the helminths are excreted from your system. If you have meat or fish, make sure it's properly cooked, because it's when we don't properly cook our fish or our meat that we're at risk of coming down with these parasitic infections.
Mm.
If you have maybe you know your genotype before, then get optimal treatment. See somebody that can manage you properly for that. For women who have heavy menstrual bleeding,
Mm.
try to make sure that the bleeding is controlled so that you don't even get to the point where your blood level is low. Okay, so something that the awareness might be a little low in our environment is what we call preconception care.
Okay.
So there's a concept called preconception care. So not technically you're supposed to plan before getting pregnant.
You're supposed to plan before
Yes,
getting.
before getting
Could
pregnant.
that be family planning?
And not necessarily family
Oh,
planning.
okay.
What I mean is that, okay, so I know that by 2025, probably I want to have another child.
Mm-hmm.
So at least 3 months to the time when I'm thinking, oh, I'll be ready to get pregnant,
Mm.
I should see a doctor, know what medications to start taking and which ones to stop taking.
Even before getting pregnant.
Yes.
Wow.
The reason for this is because some of us think that we are eating fine.
Mm.
Some of us think that we are having ideal levels of everything.
Mm.
But until your blood is checked, you never can say you have the perfect score.
Mm.
So we see some women that come down with children that have some birth defects that we know that is as a result of low folic acid in the blood. But if there was proper preconception care, you would have started taking this. So that 3 months, it takes the body to correct and then get back to the optimal levels that the body needs. So preconception care is actually the awareness is quite low in our environment, and we don't plan, we just get pregnant. So part of preconception care too would have been, I need to stop taking this medication because it puts my baby at risk. So there are some women that are on some medications, maybe antidepressants or maybe a medication for a chronic kidney disease or any other illness that you might need to stop taking before you get pregnant. So, but when you start talking to your doctor about it, if you plan your pregnancy properly, then these things can be reduced, the risks can be mitigated.
All right, we will take in your calls now on 0904 or 0904 before I would let you go, Dr. Ololade, I must say thank you very much for doing a good justice to this conversation. Let's talk about the treatment now. This will be the second to the last. Because one thing, for some people, they believe that anemia, when it occurs, I don't want to go to the hospital, it's expensive, that is when they will start asking us to bring this and all of that. The treatment, how can anemia be treated? How affordable is the treatment of anemia? That's a two-in-one question.
Okay, so the cheapest treatment is for you
Maybe we should
to.
take this call before we talk about the treatment. Hello to you. Good morning. Thank you for calling us. Yes, good morning. Thank you for calling. Go ahead, talk to us.
Good morning, our resource person, doctor.
Good morning, sir.
Good morning. Yes, my question is this. Which one is more preferable, that is more better? Is it the blood tonic or the one that wants us from food, to replace the blood you lost? So I want to know.
All right.
To source it from foods than using this supplement, blood tonic supplement. So that's my question.
All right. Thank you very much. I think that question is clear. Yeah,
Yes.
maybe we should attend to that one.
Okay, so by the time a doctor is asking you to take a supplement, it means that the blood level has dropped to a level. So, like I said earlier, I laid the foundation that for pregnant women, once you are pregnant, we know that your body is requesting for more.
Mm-hmm.
So we place you on supplements. In fact, we prefer you to start it as soon as you know that you're pregnant, your folic acid, your ferrous, you should start taking it immediately.
Mm.
Now, the reason is that we know that the body pregnancy requires more from the body.
Mm.
And if your body cannot probably get everything from that diet, it needs external help. That's why we give supplements.
Mm.
But if you are seeing a doctor and the doctor is saying, oh, you need to add this, then probably the level is a little short. So like I said the ideal is 33% in pregnancy.
Mm.
So you are seeing a doctor and your blood level is at 30%. We don't want to wait for you to get to 28.
Mm.
We don't want to wait for you to get to 27,
Okay.
because we know that it takes more to take it up to 33
Let's
than.
take another call. We have very limited time. Hello to you. Good morning. Thank you for calling.
Hello, good morning. My name is Friday from Ecuador.
Go ahead. Talk to us Friday.
Please, I heard something from the woman explanation. She said something that for you having, if you want to conceive for the second time, you should wait for at least 2 years for the body to be good again to go. So I now want to ask, is it for that 2 years, are you going to be to abstain from normal things husband and wife do? Or because the reason why I'm asking is, there are some people that will, there are some ladies that will hear that thing and that will wait for 2 years. And that 2 years they will think that is just no, I don't know, I didn't know the answer yet. Please you explain better.
All right. Thank you.
This abstaining from that.
Thank you. I could actually tell where he was going to. So please help him.
Okay, no, we're not asking our women to abstain from intercourse in that 2 years. What we are saying is that there are ways you can prevent pregnancy. There are family planning options, which you can go to the nearest health center or even to general hospital to get, to just ask for the family planning units and you'll be directed them. Now, not everything involves you taking pills, which I know that that is what most of our women are afraid of. But I want you to know that your family planning treatment is streamlined to suit you. So what suits Mrs. A may not suit Mrs. B. You need to come in for yourself, find out, and then pick what suits you. So what we usually advise is maybe immediately, maybe within the first 2 3 months, they can start with barrier method. Um, Exclusive breastfeeding gives some women some form of um contraception, but after 6 months, that decline comes in
Mm.
because you're not breastfeeding as much as you're now mixed feeding for the baby.
Mm.
So we ask them to start considering other options.
Mm.
But the advice is once your baby is 6 weeks, you come for postnatal clinic, we discharge you to go to family planning clinic. From the family planning clinic, you are presented with options, starting from barrier method to the hormonal ones to the ones that they have to insert. So you have to go through them, and some of these options are readily available. Some you might need to make maybe not available at this time, but they would always be available. You just need to know what is best for you and do it. So not we're not saying no intercourse. We're
Mm.
only saying plan properly so that you won't have to be running around in the next pregnancy.
Mr. Friday, you've heard that our doctor did not say no intercourse. Please go ahead, but then let there be proper planning. So, in just 2 minutes, it's unfortunate that I still have a lot to ask, but our time is fast spent. In just 2 minutes, let's talk about the treatment. How affordable, like I said, and what is the treatment for anemia like? Some will run away from anemia treatment because they believe that it is expensive.
Okay, yes. So the cheapest, like I said, is for you to eat well, get
Mm.
your supplements.
Mm.
By the time you are getting to the level where we need to admit you because of the symptoms you're having, if you're having difficulty in breathing, for example, or if you've lost consciousness, it's something that we need to take fast action. And the fastest action is for us to transfuse you with blood.
Mm.
Because from the raw materials you are taking, whether the blood supplements or anything, it takes at least 3 months for you to see the effect,
Mm.
because that's the lifespan of an average red blood cell. So if you say, oh, I want to use supplements to boost it up, it won't give us the fast result and the fast relief that you need at the time we're seeing you. So for example, a woman comes, her blood level is as low as 21%. I need to transfuse her with blood. Do you understand?
Mhm.
And then getting her blood type may not be as easy.
Mm.
Getting your blood type may not be available for those, especially those that have the rhesus negative factor. So what we advocate is that the cheapest, the most affordable is that you eat well,
Mm.
use your supplements, be registered in a proper healthcare facility where your blood level will be checked
Mm.
at least at every visit,
Mm.
and then you go on. If we need to treat you because your blood level is very low, we might need to transfuse you.
Mm.
Then upon discharge, give you some supplements also to boost the level up.
I want to say thank you very much, Dr. Ilori Adesanya or Lolade. What would be your parting words, your advice? And it should also go down to the men to talk about, because we have two men actually calling today. They also have a role to play, I want to believe, in helping these women out there. What would be your parting words to every woman, every man, most especially the pregnant ones out there listening to you?
Well, my parting word is eat well, eat healthy. Once you notice any symptom, present as soon as you can, because it's usually cheaper when the complications are not much.
Mm. You've heard from our doctor guest today, Dr. Ilori Adesanya Ololade. If there are more questions, I sincerely apologize. I can't take calls anymore. Our time is fast spent. Just walk down to General Hospital Ikorodu and ask of Dr. Ilori Adesanya Ololade. She's on red today. So you find out within the premises. Special thanks to General Hospital Ikorodu. And of course, special thanks to the MD, my father, my friend, for always doing this with us. I want to say thank you very much, Dr. Ilori Adesonya Ololade. Please remember your health is important. Health is wealth. And that is why every Thursdays we do this on IKD 106.1 FM. Until next week, Thursday again, do not forget to join us same time on the issues tomorrow on IKD 106.1 FM. I am Opayemi Adibambo. Stay healthy. God bless you.